Hi students, in Pratyaksha Pramana Series 6 we have discussed about equipments or enhancements that help in the process of Pratyaksha and the necessity of Pratyaksha Pramana or necessity of other Pramanas in relationship with Pratyaksha. And now in Series 7 we are going to discuss about the application of Pratyaksha Pramana in Ayurveda. An Ayurvedic physician need to use Panchendriya Parikshas in order to find out Prakriti of a person and diagnose the disease. He need to use all his sense organs like Chakshurindriya, Shrotrindriya, Granendriya, Sparshanendriya, except Rasanendriya, tongue. How all these indriyas are applied in the diagnosis of disease and in the understanding process of Prakriti will be explained in detail. Coming to first Shrotrendriya. By using Shrotrendriya, we can listen to the sound made by the movement of intestine, which is called Andhra Kujana. We can hear the sound of heart using stethoscope. We can hear to the sound made by the joints called crepitus, which indicates that there is, if more the sound of more crepitus, which means there is less synovial fluid in between the joints. And also change in voice. In some conditions like sore throat, etc., there will be a change in voice, which is denotive of that the person is suffering from sore throat. So these are the things that can be assessed by Shrotrendriya. Coming to the second, that is through Chakshurindriya. Through Chakshurindriya, we can understand about the shape, size, color of a wound or a pimple or a swelling, etc. By seeing a patient, many things can be assessed by using our Chakshurindriya, like whether the patient is middle-aged, old-age or young-aged, whether the patient is obese or lean, whether the patient is restless or whether the patient is having anxiety, etc. These things can be assessed with the help of our Chakshurindriya. And Chakshurindriya will also help us to have an understanding about the Prakriti of a patient. Coming to the third, that is Granendriya. By using Granendriya, we can identify between normal and abnormal odor that is coming out of the body. Now we have to understand what is the significance of normal and abnormal odor that is coming out of the body. Acharya Charaka in Indriyasthana has explained about normal and abnormal odor or normal and abnormal gandha that is coming out of the body. As per Charaka, some gandha or some odor are indicative of imminent death. Means if person is emitting some kind of smell than the usual, it indicates that that person is going to have a imminent death. This is called as Arishta Lakshana. Detail about this is explained in Indriyasthana of Charaka Samhita. The fourth is Sparshanendriya Pariksha. Using Sparshanendriya, we can understand about the nature of temperature, as in fever, whether it is high temperature or whether it is normal. We can understand about the pulsations, especially we can take the pulse. and you can understand about the pulsations that happening in the neck, like this. You can understand about the nature of the skin, whether it is dry, whether it is oily, etc. So by the touch we can understand nature of many conditions, or we can understand nature of the disease in many situations, like especially in the condition of swelling. So Sparshanendriya Pariksha is also helpful. Coming to Rasnendriya. Rasnendriya is normally don't used in the process of examination. Physician will not use Rasnendriya for the examination of patient. Instead, he will use Prashna and Anumana Pariksha in order to understand many things about Rasnendriya Pariksha. What he will ask the patient is that he will ask the patient whether you are having good taste or bad taste in your mouth, whether you are having appetite or not. This is comes under Prashna, and in Anumana, the physician will analyze the nature of urine of the patient. If in the urine of the patient, if more ants are coming, then we have to consider that urine is containing sugar. So this is how Rasnendriya Pariksha is done, and normally it is not used directly for the examination of patients, diagnosis of some disease conditions. Coming to an end to Series 7 Part 1.